Hi, good day everyone. Today we'll be speaking about atherosclerosis. Our group members include Nandini Samsundar, Nicole Sarup, Nived Sahadeo, Parbati Sukhdeo, and Debbie Samsundar. According to the World Health Organization, heart disease is the number one cause of death in men and women. It accounts for 16% of the total deaths globally and has been a leading cause of death for 20 years. Here we can see in 2019, approximately 8.9 million deaths were recorded and attributed to heart disease. Coronary heart disease is a disease where a substance called plaque builds up in the arteries over time. The buildup of this plaque leads to the hardening and narrowing of the arteries. This occurrence is termed atherosclerosis. Atherosclerosis can lead to serious health-related problems, including heart attacks, stroke, or even death. This animation demonstrates the position of the heart and highlights the coronary arteries. Healthy arteries are strong and elastic due to the structure of their walls having smooth muscle and elastic membranes. They become narrowed between heartbeats so as to maintain the blood pressure. The constant pressure assists in moving blood to all parts of the body tissues. In atherosclerosis, plaque builds up inside of the arteries, which is known as the lumen of the artery. This plaque is a waxy substance that is made up of fat, cholesterol, and calcium, among other substances present in the blood. As time passes throughout a person's life, the plaque builds up and narrows the coronary arteries. This buildup limits the flow of oxygen-rich blood to the heart, along with other key essential nutrients. This lack of oxygen can then induce chest pains and discomfort, which is termed angina. As time passes, an area of plaque buildup can rupture. At this site, a blood clot will form. If the blood clot is large enough, it will almost completely block the flow of blood through that coronary artery. This in turn leads to a heart attack, as the cardiac muscles of the heart will be oxygen deprived. Here's another animation demonstrating the formation of a blood clot leading to the restriction of blood flow through that artery and the effect it has on the heart and the cardiac muscles.
Risk factors of atherosclerosis. Atherosclerosis is a condition that becomes worse over time and can start as early as childhood. The precise reason is not known. We do not know why. Atherosclerosis is usually considered a heart problem. However, there is a possibility that it may affect any arteries in the body. The type of artery affected and where the plaque develops varies from person to person. It can begin with harm or injuries to an artery in a layer. Some risk factors of atherosclerosis include elevated levels of triglycerides, low-density lipoprotein and cholesterol, elevated blood pressure, smoking, type 1 diabetes, obesity, predominant inactivity, and diets high in saturated fats. With that being said, there can be many risk factors that can lead to atherosclerosis. However, we will just be talking about a few of the main risk factors, which may include Smoking is a major risk factor. The chemicals that you inhale when you smoke can cause damage to your heart and the inner lining of blood vessels that would most likely cause the development of atherosclerosis, or it can accumulate plaque buildup in the arteries. If you have other heart diseases like high blood pressure, obesity, or high blood cholesterol levels, and you smoke, it raises the risk of getting a heart disease more than it was before. Also, if you secondhand smoke, which is when someone else is smoking and you inhale the smoke, that as well can damage the heart and blood vessels the same way as a person that was actually smoking. Obesity is an important risk factor for atherosclerosis. Being overweight or obese can contribute to the development of atherosclerosis, as excess body fat can lead to high cholesterol levels and chronic inflammation. Chronic inflammation in the body can damage the inner lining of blood vessels, which triggers the accumulation of low-density lipoprotein cholesterols in the arterial walls. Obesity raises both total cholesterols, which are low-density lipoprotein cholesterol, which is bad cholesterol, and reduces the high-density lipoprotein, which is good cholesterols. High levels of low-density lipoprotein and cholesterols increases the chances of accumulation in the walls of arteries, which increases the likelihood of plaque formation and the narrowing and hardening of arteries over time. While persons suffer from high blood pressure, it can damage the inner lining of arteries or blood vessels by making them less elastic. This would decrease the oxygen and blood flow to your heart, which would lead to heart disease. Persons with diabetes are at risk due to the elevated sugar levels that's damaging the interior walls of the blood vessels. Both of these make the interior walls of arteries more susceptible to plaque buildup. Smoking has also been attributed to the increased damage to the interior of blood vessels.
The symptoms that you may experience are things like chest pain, cold chills, dizziness, weakness in the body, mostly in the legs when moving, as well as cramping, even difficulty in thinking and remembering things. In some cases, in men, even erectile dysfunction is an early indicator. It is possible to have atherosclerosis for many years without experiencing symptoms. It is important that you become aware of these symptoms, as it could lead to more serious conditions such as heart attacks or even strokes. Some people may experience shortness in the breath, tightness in the chest, and are unaware only until further testing is being done.
We now move on to treatment options. These include lifestyle changes, medicinal, and surgical options. As we can see on the slide, there are three images: a balanced diet, a no smoking sign, and two individuals that are jogging. This is the most simple but yet complex treatment option to maintain a healthy lifestyle of a diagnosed patient. This can be achieved by limiting saturated fats, food that are high in sodium and added sugars, consuming a lot of fresh fruit, vegetables, whole grains, and exercising regularly are also beneficial in keeping the cholesterol and blood pressure at an appropriate level. As we move on to the medicine aspect, we will talk about the classes of medications that are essential in treating a patient with atherosclerosis. Diuretics are medications that help to relax the walls of the blood vessels, whereas antiplatelet helps to prevent the platelet from sticking together and forming blood clots. A common example would be the drug clopidogrel, which is branded as Plavix as shown. Lastly, we would speak about warfarin. Warfarin is an anticoagulant that is used to slow down the body process of making clots. Here we see two diagrams, a carotid endarterectomy and a carotid artery stenting. Endarterectomy is used to treat peripheral artery disease or carotid artery disease. This is where an incision is made directly over the blocked artery during the procedure, as shown. The plaque is then removed and replaced with a stent. We may ask ourselves, what is a stent? A stent is used to allow the free flow of blood through the artery. We will now move on to stent with balloon angioplasty. Here we are seeing four diagrams. Diagram 1 shows the buildup of cholesterol partially blocking blood flow. We may ask ourselves, what is an angioplasty? Well, an angioplasty is where a flexible tube called a catheter or balloon, in this case, as seen in number 2, is used to stretch open a narrow or blocked artery, as shown in number 3, followed by a short wire mesh known as a stent. What a stent allows is for the free flow of blood by widening and keeping the lumen of the vessel dilated to allow the free flow of blood. We are currently viewing two images of the heart that shows the before and after of a coronary artery bypass surgery. We would also see on the annotation on the diagram where the bypass graft is placed. Here we would see four different images with four different placements of the bypass graft: single, double, triple, and quadruple. What these graphs allow is the free flow of blood throughout the heart.
Here is a brief synopsis of what we have learned. Atherosclerosis is a gradual buildup of plaque in the walls of the arteries that carry oxygen-rich blood to organs and tissues throughout your body. Risk factors contributing to this are high cholesterol and triglyceride levels, high blood pressure, smoking, diabetes, obesity, physical inactivity, and eating saturated fats. Symptoms may include angina, known as chest pains, cold sweats, dizziness, extreme tiredness, heart palpitations, which is feeling that your heart is racing, shortness of breath, nausea, and weakness. Atherosclerosis treatment comprises of one or more of different medications, procedures, or surgeries and lifestyle changes. In conclusion, atherosclerosis can be prevented or managed by acquiring a healthy lifestyle. It is shown that healthy lifestyle should incorporate a balanced diet, weight loss, exercise, and no smoking can all contribute to lowering the risk of developing atherosclerosis. Although there are a number of risk factors associated with atherosclerosis, as long as the proper changes are made, the chance of developing atherosclerosis and having it affect your quality of life is very low.
Thank you for viewing our presentation, and I do hope you enjoyed it.